Good morning, everybody. I'd like to welcome all of you to the 13th Annual Caregivers Journey Conference. My name is Donna McGowan, and I happen to be the CEO and Executive Director of the Alzheimer's Association Rhode Island Chapter. I am so delighted to see everyone this morning. I hope that this conference provides the opportunity for you to learn more about the disease and other dementias, to consider strategies that we'll be sharing with you throughout the day, and to experience the support of others who share your path. I would like to take this opportunity right now to thank our following sponsors. Our presenting sponsor, Office of Healthy Aging. Our platinum sponsor, the Rhode Island Department of Health, the Rhode Island Geriatric Education Center, and AARP of Rhode Island. And our gold sponsors, Blue Cross Blue Shield of Rhode Island and United Health Plan. I wish to thank LCD Communities for providing the walk in their shoes immersion experience. Absolutely. And a huge thank you to St. Elizabeth's Memory Care Center for providing respite care for the entire day in the Tiverton Room. Also, please make sure you get to visit all of our 48 exhibitors today. The services, businesses, and organizations with us today are here to support you in your journey as a care partner, family caregiver, and/or a person living with Alzheimer's disease or a related dementia. Let's have a great round of applause for all these sponsors. I am so honored and so proud to be here as we take this all-important next step in the fight against this dreadful, horrible disease. With the help of all of you and so many Rhode Islanders who have been affected by Alzheimer's or related dementias, we have come so far in our battle. I really can't understate that it has been a real battle, and our enemy has been a true killer. Here in Rhode Island alone, more than 22,000 of our fellow Rhode Islanders are living with Alzheimer's, and more than 36,000 loved ones and unpaid caregivers are supporting them. And throughout the United States, more than 6.9 million people have been diagnosed with the disease, and well over 11 million unpaid caregivers provide support to these affected Americans. This is not only a local, state, but also a national crisis. Although most Rhode Islanders and Americans likely know someone who is living with Alzheimer's or a related dementia, if people think it's not their concern, please listen to these stats. 1 in 3 seniors will die because of Alzheimer's or a related dementia. Alzheimer's disease costs the government more than $350 billion a year and more. Now, on that trajectory, along this trajectory that we sit on right now, with no cure or any drugs to really slow it down throughout the state, all of the stages, this disease will bankrupt the United States of America by 2050. That's a reality. And by 2050, the disease is expected to cost our government $1 trillion. However, there's so much good news here and now. Exciting times. For exciting times for the history of this disease, we are now in the era of treatment, as the U.S. Food and Drug Administration has approved drugs which have been proven effective in slowing the progression of the disease for those with early onset Alzheimer's. The most promising of these drugs is right now lecanemab. However, there are more in the pipeline. This drug is available by prescription, so a huge round of applause. We haven't been able to save anything since the disease was discovered. We have drugs approved and ready for folks in early onset, which will give them a longer quality of life in the early stages of disease. That's huge. A round of applause for that. close by sharing that our Alzheimer's Association helpline telephone number. If you or someone you know needs support related to this disease, please call us. This helpline is available 24/7 around the clock and is managed by specialists and master level clinicians, offering confidential support and information to people living with dementia, caregivers, families, and the general public. Most of all, this service is free. The toll-free number is 1-800-272-3900. 1-800-272-3900. Now, if you're calling it from your cell phone during normal business hours, Monday through Friday, if you're calling with a Rhode Island cell phone, you're going to get the Rhode Island chapter office. If you're calling with a California cell phone number, you're going to get the California office. But at night, you're going to get the main client center, our call center, that's open 24/7 on the weekends, and they do amazing work, just like the local chapter offices do. They represent us very, very well. So please, if you haven't used this service, encrypt this into your memory or write it down or stop at our registration table. Again, the number is 1-800-272-3900. The Alzheimer's Association website is www.alz.org, and it offers a wide range of dementia and age-related resources that connect individuals facing dementia with local programs and services. We also provide easy access to resources, community programs, and services in all of our local communities. Some housekeeping items. Please know we have volunteer guides here today from the Community College of Rhode Island under the direction of Dr. English Morgan, who can assist you in locating breakout rooms or if you just need a bit of assistance planning. They're wearing green golf shirts and their student ID, so please feel free to approach them if you need any assistance. Please silence your cell phones now, if you haven't already done so, and during session. You can find the Wi-Fi and password for the Crown on the registration table, but I'm going to give it to you now. The network name is, in caps, IHG1 Rewards. The password is WRWRI. We are recording the breakout sessions for your use after the conference is over, and we will be sending you an email regarding access within the next 2 to 3 weeks. If you need any assistance at all today, please visit the registration table and we can assist you, and that table is smack here right in front of these doors. So I would be remiss right now not to thank my staff under the direction of Annie Murphy. Annie, give a wave, a shout out to Annie. And runs like a charm. Meg Coughlin, Meg, put your hand up, give a wave. Laura Crawford and Jennifer Finley, David Collin, and Geraldine Mitchell have all been instrumental in helping Annie Murphy, or I should say Margaret Annie Murphy. She denies that name, Margaret, vehemently. And also, I would be remiss, we have so many amazing volunteers with us here today. You know, we couldn't do this without our volunteers, so a huge shout out, a huge round of applause for all of our volunteers today, helping me last but not least, I'd like to recognize Vivian Spencer from Senator Sheldon Whitehouse's office. Vivian, I don't know if you're in here sitting now, but she's been out roaming around saying hello to everybody. We have a wonderful congressional delegation here. David Carlin and I just came back from our travels in Washington, D.C., advocating for more funding primarily from the NIH for this fiscal year, or not this fiscal year 25. We had successful meetings. Our congressional delegation is all in. They understand the world of dementia and Alzheimer's, and they do whatever they can do to support our efforts at the local, state, and absolutely at the federal level. So a huge round of applause for Vivian Spencer and our So now now gives me great pleasure to introduce Maria Samini, Director, Office of Healthy Aging. Maria.
Thank you, Donna. Good morning, everyone. I want to start by saying thank you to Donna, to Annie, everyone else at the Alzheimer's Association for the invitation to come speak to you today. And I'm thrilled to be here for the third time as the Director of the Office of Healthy Aging to honor and recognize the incredible work that you do as caregivers and to share with you the types of resources available from the Office of Healthy Aging and from other community agencies to support your work. We honor and recognize caregiving as a critical component of not just our larger community, but your individual lives. Both as government, we have a role to support you in this work as you support your loved ones. And so we're here to do that for you. The Office of Healthy Aging, formerly known as the Department of Elderly Affairs in Rhode Island, is a proud sponsor of this event, and our mission is to support older adults in the state of Rhode Island, for adults with disabilities, and their caregivers. You are part of our day-to-day work. So let me tell you a few ways that we do that, ways that you can connect to and learn more about. And I can say that I have a team out in the hallway there, so if you miss anything I say, please go out and say hello to them. At the Office of Healthy Aging, we support and convene the Family Caregiver Alliance of Rhode Island through our partners at the United Way of Rhode Island. That's a group of individuals, professionals, and people with lived experience as caregivers who come together on a regular basis to identify the programs and policies that would improve the lives of community caregivers. I encourage you to reach out to the Family Caregiver Alliance of Rhode Island and the United Way of Rhode Island to learn more about their work and how you can inform what you need in your life to support you and your loved ones. We support groups in the community. You all probably are aware that there are senior centers and community centers that offer support groups to caregivers. And if you don't know where they are, I encourage you to join one of them. You can learn about them from the Alzheimer's Association or by calling the point, 462-4444. I always do commercials for the point. I encourage you to call them. 462-4444. You can get connected to all of the things I speak about now. The Office of Healthy Aging, with our partners at Catholic Social Services, also supports respite. Sometimes you need some time, and that might be an hour or two. It might be a week off. There are opportunities for you to get that respite time, to have people come into your home or to have your loved one go to a facility for a couple of days so that you can catch your breath, or maybe take a nap, or maybe go to a wedding. There are any number of reasons why you might need time, but you need it in order to be able to continue to be the best caregiver for your loved one. We support home care and adult day services through our at-home cost share program. Most people are aware that there's a Medicaid program, the Home and Community-Based Services of Medicaid, that supports individuals with those resources. But if your personal resources are too high, if you have money in the bank, or you own too many things of value, or the income is too high, there's another option, and that's called at-home cost share. You can access that through our office, or by calling 462-4444. They'll help you learn how to access that benefit. We can make referrals through the point or through the Alzheimer's Association. As Donna said, 800-272-3900. I like to give up phone numbers if you couldn't tell. They're both ways to know what exists, because I'll tell you this, there are more resources than you could imagine. There are not enough resources, and there are not always resources that meet your particular needs, but there are a lot of resources. But figuring out where they are is like finding a needle in a haystack. So use those phone numbers. Call those individuals in those organizations. They know where the resources are, and they can help you find them. Additionally, at the Office of Healthy Aging and with the Family Caregiver Association of Rhode Island, we try to improve policies to support you as well. Right now in the state of Rhode Island, there's an opportunity to increase the temporary caregivers insurance program. That means that those of you who are working and paying into TDI can take time off of work to support your loved one. Either a few days, a few hours, a few weeks, and there's an opportunity to expand that program right now. We are encouraging the expansion of temporary caregivers insurance. It is a way to support you as you support your loved ones. And I hope that our General Assembly passes it because it will improve our lives. I want to just pause and say every member of my team at the Office of Healthy Aging is a caregiver. Every single one. At least once a week, someone is sending me an email or popping their head into my office, or I get an email from HR saying so-and-so is family medical leave, their father is on dialysis, their mother needs time to recuperate, their child is sick. So this is our day-to-day. This is my third year here. And I come here and I tell a little bit of personal tale too, because I used to start by saying I have 5 older adults in my life that I have responsibility for. That the policies of older adults in Rhode Island will be based on the Sanini family. Because I walk into my office every once in a while and turn to my team and say, what am I supposed to do right now? Because if I can't figure it out, as the director of the Office of Healthy Aging, what do we have? What hope do any of us have? And I noticed that the title of this conference is a Caregiver's Journey Conference. When I first stood here 2 years ago, I shared that my mother-in-law had dementia, that we had identified it during COVID when we realized that there was financial scams happening and she was draining the bank account. And last year I talked about how my father-in-law and my mother-in-law had great in-home services. We had connected with Caroling and had a wonderful occupational therapist coming out, doing really wonderful supports for my father-in-law to help him support her. But you know, the journey continues. And last December, my mother-in-law went into an assisted living facility. It was a hard decision. My father-in-law did not want it to happen. He was like, no, I need her at home. But she was starting to wander too much. And thankfully we did that because a few weeks later, my father-in-law was in the hospital, and 2 months ago, he passed away. The journey. It's what it is. Right? I have no great words of wisdom for you, other than to say that you are not in this alone. None of us are in this alone. Even though it feels like that sometimes, like at 2 o'clock in the morning when you get the phone call, or when you're struggling to make sense of what to do next. You are not alone in this. The Office of Healthy Aging is here to support you with programs and to inform policies so that you are able to provide the care that you need to your loved ones. The Alzheimer's Association of Rhode Island is an incredible partner of the Office of Healthy Aging and is such a leader in this work. And there are so many other agencies, and look around this room. I'm so glad that we're together, because while Zoom is really helpful, especially when you're a caregiver, it's very helpful to be able to sit at home on a computer and participate. But it's so powerful to be in a room with other people on a journey that often feels very isolated. So I thank you for inviting me to be here today. I'm so grateful that you are all doing what you do, and I recognize the struggles and the difficulties and the deep love with which you do it. I wish you all the best. I know you will learn from each other and lean on each other today and throughout your journey. And I thank you for having me.
Thank you so much, Maria. This is a journey, and you are not traveling it alone. There are lots and lots of people and resources available. A lot of them are here today. So in your break times, if you can take the time to traverse around the 48 vendors that are with us, they all provide services, of some of which you're going to need or you might need now. So I highly encourage you to socialize as much as you can, make new friends. Look to your left and your right now. Look to the person next to you and just say good morning and tell them who you are, please. And since I have nobody to my left or right, again, I'm Thomas Galvin, and I'll be floating around all day, so please feel free to to approach me and come up and chat. I'd love to meet you. I'd love to hear your story. So at this time, welcome to our morning session, which is introducing the updated Rhode Island Alzheimer's State Plan for 2024 to 2029. A very exciting, livable, breathable working document. Victoria O'Connor is the program manager for the Alzheimer's disease and related disorders program at the Rhode Island Department of Health. Her passion for supporting people living with dementia and their caregivers is inspired by her own personal experience with loved ones living with dementia and the many stories from community members sharing their connection to this condition. Victoria's previous work in community-based organizations and focus on health equity has propelled her career in public health. Victoria is a graduate from the University of Rhode Island in 2016 and is currently finishing her master's thesis in healthcare administration at Rhode Island College. It's my pleasure right now to present to you Victoria O'Connor. I'm a little taller. How's the volume, okay? Can you hear me in the back? Great. All right, well, thank you. I want to start by thanking the Alzheimer's Association, Donna, Annie, and her team for inviting me to speak today. I was asked to give an update on what is sort of happening and the goings-on at the state level as it relates to our state plan. So I titled my presentation, Caregiver Engagement, How, What, How, and Why, and we'll get to some of those points along the way. But I want to start by introducing my Grammy Louise. She is sort of my vision behind this work. As Director Savini said and Donna said, we all sort of approach this in different ways, and many of us have personal experiences. She passed last year of vascular dementia. She was humorous right up until the end, fiercely stubborn and independent, wanted to stay at home. Did I mention fiercely stubborn? She, maybe these are traits, that you're recognizing in your loved ones, but she certainly has encouraged my work. Just to introduce our program a little bit more, so I oversee the Alzheimer's disease and related disorders program at the Rhode Island Department of Health, and we are federally funded by the Center for Disease Control and Prevention, or CDC, through what's called the BOLD grant, B-O-L-D, and we do a lot of bold work, so I think it's a fitting name. We receive $500,000 a year, and we are currently funded from now until 2028 to address dementia through a public health approach, which can mean a lot of different things. We've got a very broad goal, but just to introduce a little bit of my program and where I'm coming from. So going back in time, we had the 2019 state plan, which was introduced by then Lieutenant Governor McKee, now Governor McKee. It outlined, I believe, 34 recommendations. We have a statewide advisory council. Many of the members are in this room today that reviewed that state plan right after COVID hit to sort of think through. This was released in 2019. What have we done since releasing that plan? And during that review process, we found that we had achieved, or at least were in progress, with 20 of the 34 recommendations, which was really amazing to see. And the reason the state plan is so important is that it enables us to receive the federal funding. So that is part of the requirements from CDC, is that we have the state plan in place. So what did we do with the 2019 state plan? Of all of the 34 recommendations, there were 3 that really rose to the top in terms of importance and priority. So the first of which was to essentially create a full-time position at the Rhode Island Department of Health that would focus on Alzheimer's disease. And I'm here to tell you that that person is me. So we've done that. My position is federally funded, so we're still sort of searching for that opportunity to sustain my position with state funds. But we were able to bring that focus to the Department of Health, which we never had before. Of course, we focused on target populations and serving older adults, but Alzheimer's disease is very new to the scene in terms of public health, and we're really excited to have a program at the Health Department.
The second of the top 3 recommendations was to promote research of all kinds. And hopefully you have had an opportunity to visit Butler Hospital, who's here today, the Mood and Memory Disorder Center, as well as the Alzheimer's Disease Center at Rhode Island Hospital. They have worked really hard to collaborate and integrate their strategies to recruit individuals for research and clinical trials, with a real focus on increasing the diversity of participants who are participating in those trials and research. And the third of the top 3 recommendations was to think about Alzheimer's disease as it relates to other chronic health conditions. So there's a lot of overlap between conditions like diabetes, hypertension, obesity. We see physical inactivity as a risk factor for dementia. And we have programs at the health department that are focused on those types of conditions. So we've been really challenging ourselves to use phrases like, what's good for your heart is good for your brain. And if you'd like to think about how to kind of not prevent entirely, but decrease your risk of having dementia, you should be thinking about managing chronic conditions like diabetes, hypertension, etc. So top 3 recommendations achieved and ongoing. It doesn't just stop today. Some other things that we accomplished from the 2019 state plan that I want to bring to your attention. One is to increase the availability and use of data about Alzheimer's disease. So Donna mentioned some of the statistics today, 22,000 plus people living in Rhode Island with Alzheimer's disease that we know of. Those are just people who are diagnosed, but we know that many are not diagnosed and don't get captured in that number. I think it's around 39,000 plus caregivers identified in Rhode Island. And we've been able to use data throughout the state through what's called the Behavioral Risk Factor Surveillance System, or BRFSS, to learn more and bring more data about people living with dementia in Rhode Island. So we've been able to achieve that as well. We have talked a lot about increasing collaboration among the different universities in Rhode Island. We're very lucky to have a lot of different state colleges and universities. And we've been working really closely with Rhode Island College to develop a 30-hour dementia certificate program that comes with a credit attached to it. So for people in the workforce who want to learn more about how to increase their knowledge, skills, competence for caring for this population, we've developed a training program to do just that, which comes with some college credit attached to it for a nice incentive. And I believe that kicks off on May 18th for the first time. And lastly, we were charged with developing different types of resources, web, online, offline, to assist you in your journey. So hopefully that's part of why you're here today, is finding resources. And I want to point out one that we're really excited about, which is called the Rhode Island Brain Health Guide. If you are savvy with your phone, this QR code should take you right to the resource. If not, you can also stop by the Department of Health table, and we've got a few copies as well in hard copy for you. This guide not only identifies the different types of resources that are available, it also suggests action steps that you might consider taking throughout the stages of the disease process. So one thing we were hearing a lot from caregivers was, I've been told I'm in this middle stage of dementia and I just don't know what to do next. So this provides a list of sort of action items that you might consider kind of figuring out as you navigate the disease process. But rather than coming up with those action items yourself, it lays them out here for you in the guide. So that was the 2019 state plan, some of the work that has happened since then, and we're really excited to announce the release of the 2024-2029 state plan. This lays out 4 different kind of areas of focus that we'll kind of think through in just a little bit. It was developed by our advisory council, again, a statewide group of subject matter experts, different professionals coming together to really think about this work. And we've laid out 36 strategies in our new state plan. So here are our goal statements. We've got one focused on community, and I will not read these to you, but you can see them on the screen. But we have this community focus because we know that a lot of the care for people living with dementia happens in the community, not just within facilities or in different institutions, but in our own homes. And being able to increase access to different resources within communities is a really important goal for this new state plan. Our second goal is focused in the workforce. So this is the idea that we would be able to increase the knowledge level, skills, competence, confidence level for people who are providing care to people living with dementia within different healthcare facilities or within home health aides within your own home. So a lot of focus on different training opportunities like the one I mentioned with Rhode Island College and other opportunities to train healthcare professionals. And we know that this isn't just physicians, although that is certainly part of this, but thinking about different healthcare teams and their role in supporting people living with dementia, it doesn't always happen at the sort of doctor level. The third goal is focused in the health system, so thinking about how to provide the right care at the right time and in the right location. We've got a lot of work to do on this goal, but exciting to think about different strategies that are specific to the health system. And our last goal, which I am biased, but is my favorite, is our public health goal. And we're hoping that Rhode Island is seen as a leader in the nation in terms of addressing dementia through a public health approach. I will tell you for the funding that we receive, it is competitive. So we have to write an application and be very persuasive so that Rhode Island receives this funding. In the first cohort of funding, we were one of only 16 states to receive this level of gold funding. And in this next cohort, we were one of, I think, around 40 states. So we're very lucky in Rhode Island to be able to have this funding in our state and support some of the strategies in our state plan. Okay, that was the what. Now we're moving to the how. How can you participate in our state planning process? How might you be able to inform the state plan? And I want to let you know about our action planning sessions. So at our table, which is out this way and around the corner, at our Department of Health table, you can sign up to participate in an action planning session. There are 2 in the next coming weeks that are available. These are sessions that sort of break through the different sector areas, and then you would be able to identify different tasks and strategies or action items that would be needed to achieve our goal statements. This is open participation for anyone in this room, and I think it's a really nice opportunity for anyone to get more engaged and involved with our state planning process. So please find me at our table throughout the day if you're interested in participating in this. I would just need your email. If they're virtual sessions, and we can get you hooked up to an action planning session. So why? So this is my favorite part of the presentation, and if you're like me and like data, then you will like this part. If you don't, I think you'll still like it. So hang in there. But why should you participate? Mainly because your voice matters. As caregivers, you have unique experiences, firsthand experiences that we at the state level or in a professional kind of location don't always get to have or acknowledge. And that experience is really important and can inform our state planning process. And the real why for why I think you should participate is really sharing some of what we know about caregivers in the state and nationally. So 83% of care provided to older adults is provided by caregivers and unpaid caregivers. 48% of caregivers are providing care to someone with Alzheimer's disease. That's nationally. More than 11 million provide unpaid care nationally. And here's the $1 billion. So if you're like me and you've never seen $1 billion, it's hard to imagine that number, 346 billion. It is 57% of the net value of revenue of Walmart, and it is 15 times the value of McDonald's. So essentially, unpaid caregiving in the US is a Fortune 500 company So if anyone has a solution, you could be a billionaire. In Rhode Island, I think we've shared these statistics already. It's 36,000, it's probably really much more than that, who are identified caregivers in Rhode Island. There's a lot of unpaid care that happens. 54% experience chronic health conditions. This is really important. Caregiver health is very important. 41% experience depression, and over 11% report poor health conditions. So as you're here today thinking of your loved one, I want to challenge you to also think about yourself and some of the services that might be available to help you and help your own health. I've got just 2 more data slides left and then we'll wrap up, but I think this one's really interesting. So what you're looking at is a chart that shows you the different activities of daily living. So getting dressed, bathing, using the bathroom, etc. In the purple, you're looking at the experience of caregivers for people with dementia, and in the blue, you're looking at the experience of caregivers for older adults. And you'll notice that for every activity of daily living, it is more challenging for that person with dementia. So you're spending more time kind of supporting them through the different activities of daily living. And we can't talk about caregiving without the economic burden. So again, here you're looking in purple at the experience of people caring for someone with dementia versus blue caring for someone who is an older adult. For the different activities on the bottom, you have gave up a promotion, left early from work, left their job entirely. You're seeing that experience, of course, is more difficult when you're caring for someone with dementia. We also know 2/3 are women. Many are caring for their loved one and their child at the same time. We call that the sandwich generation. It's a journey, and that's why we're here today. I'm hoping that this data kind of gave you something to think about as you move through the sessions. And I'm giving you some homework. So before I let you loose into your sessions of the day, here are some things that I want to sort of leave you with. I've talked a lot about the state plan and different data points for you, but want to make sure that you're leaving with some tangible tasks. So one is to connect with us at the Department of Health's table. There you can find different resources for chronic diseases. We do have a few copies of the Brain Health Guide there, as well as the online QR code that you can access, and an opportunity to sign up for those action planning sessions. So if that's something that interests you at all, please come find us at our table. So you can take home the Brain Health Guide and you can sign up for an action planning session. We want you to engage with the Alzheimer's Association chapter. They are amazing. They lead the state in terms of providing resources and education and information. Please connect with them today if you haven't already. Connect with each other. As Donna said, look to your left, look to your right, say hello, get to know each other. And last but certainly not least, please enjoy the day. You're here, and that means a lot to us. We're really happy to see you. So thank you. I might be standing here for questions if anyone has a question. Do we have a mic? She's bringing you a mic.
One thing that I did notice was missing the whole thing was the interface between the Department of Veteran Affairs and your whole department, the Department of Healthy Aging. I didn't hear one mention, and there are so many veterans who have to wait 3 to 4 years to get into veterans home, and then you add the difficult bridge. I mean, it makes the whole thing, how does a caregiver get there? And it goes on and on, but I'd like you to speak a little, please, to how you are planning to, because it wasn't mentioned at all.
Yeah, no, that's a really good point. Yeah, so the question was about thinking about veterans and the Veterans Affairs Office. I can tell you certainly from the Department of Health perspective, and I'm sure Director Savini would say the same at the Office of Healthy Aging, that among the state agencies, we are so interconnected with the work that we're doing. We do have an advisory council that is a statewide group, and I think that's a great idea to invite someone from that Veterans Affairs group to be a part of our work and really integrate them, so that they have an understanding of what the experience is like for dementia caregivers and how the information and kind of the background resources that we talk about on a regular basis to be able to offer that to their kind of population. But I think it's a really good point and certainly a group that we'd like to engage with more. Okay. Any other questions, comments? She's gonna bring you a mic.
It seems silly, but on the slide you had with the purple and green or whatever colors, was the second slide? Yeah, the one on the bottom. There's one, I couldn't read it, but there's one that it's equal. What's the one that's equal?
Say it again?
What's the one that's equal? See, it's 70, I think it's 75, 75, or 77.
It says received a warning.
Oh, that's for people with Alzheimer's and just older adults.
These are caregivers in the workforce and what their experience has been like. So across the bottom, you have went in late, left early, or took time off. Pretty big gap between the purple and the blue. Next to that, went from full-time or part-time to cutting back their hours. Next to that, took a leave of absence. Gave up working entirely, 9% versus 5%. Turned down a promotion. Received a warning about performance. Lost any benefits at all, or retired early. So this is just showing you that caregivers in the workforce are experiencing more challenges than those who are caregiving for an older adult.
Thank you very much.
Sure. Oh, one question over here. They're coming.
So I just have I work for a company that's data driven, so I have a question on your data. I live in Rhode Island, but I work in my healthcare in Massachusetts, because I work in Massachusetts. So does any of this data capture like just Rhode Island, or is it nationwide, or, yeah, if it doesn't, I think, like, my husband has dementia, is he a part of the data, or how do you get your data to this? I mean, it's startling when you look at it, and everything on the bottom, I still work, and I still get nervous about all of the bottom pieces. Fortunately, I work for a very good company that has care for me, but I just wonder how you get your data. Is it just
Good question.
or New England?
Yes. So all of the data that you see in this presentation comes from the Alzheimer's Association. They release what's called the Facts and Figures report every year, annually. And they do nationwide data. This graph is showing you nationwide experience here. But a couple of screens ago, on the left, you're getting the nationwide data. On the right, you're getting Rhode Island specific. So with the Facts and Figures report, they will do state profiles. And that captures Rhode Island, people who live in Rhode Island. And so on the right, that 36,000 plus, that is only in Rhode Island. And it's more than 36,000, but that's what we're able to capture from a data standpoint. And that information comes from the behavioral risk factor surveillance system. Hopefully that helps. The Facts and Figures report is a public document that you can find through their website. And there's a lot more data that I could have shown you today, but it's a really interesting report to read through if you're curious about this. Last question?
Victoria, you answered this already. I was going to ask if we would have access to these slides afterwards.
Oh, can they have access to the slides? I think so, right?
Yes.
We will find a way to get them to you.
Thank you.
All right. Well, again, I want to thank everyone for being here, and enjoy the day. I guess I'll give it back to Donna. Thank you.
Thank you so much, Victoria. So, you need to go forth, prosper, multiply. You need to learn not to be quiet. You need to exchange information, contacts, etc., etc., etc. This is your day. I want you to enjoy it, but I want you to make the best of it. And I'm just looking at this little lady in the front about the veterans question. And I also, if you don't already know, there is a veterans advisor in both Senator Jack Reed's office and Senator Sheldon Whitehouse's office. It doesn't have to be a federal level discussion. It can be a state level discussion. They will help. So please, we tend to shy away. Nobody's going to get in trouble. That's what Andrew is there for in Senator Sheldon Whitehouse. That's his job. So make sure you make use of the congressional delegation and the experts that reside with the senators to help them get their job done. So have a wonderful day. Please thoroughly enjoy it. And just pretend you're off in Montego Bay under a palm tree and you're going to soak up as much as you can. Thank you.